Ladies and gentlemen, I come to you today with very bad news. The world is not prepared for the next global epidemic. These are the findings of 4 separate committees which assessed the performance of the WHO in the aftermath of the Ebola virus in 2014. The reason is not far-fetched. You see, by design, the WHO is not meant to be a first responder to disease outbreaks. Not at all. That responsibility is solely that of national health systems. We should be concerned, because it means that a weak health system in any part of the world is a threat to international public health, keeping in mind the interconnectedness of our world, where diseases can now be transmitted from one point to the other through global travel. It is for this reason that my PhD research investigates how to transform weak health systems through the right to health. The choice of human rights as my framework is because it calls upon states to internalize public moral norms which promote equity in health. My preliminary findings indicate that there are 4 key strategies that are essential to any effort to transform a health system through the right to health. The first is the international framework, where we have a rich collection of treaties which protect and promote the right to health. There is a correlation between the international framework and domestic systems, because I have found that states that are engaged with that framework tend to do well in their national health system. The second is the Constitution. The Constitution is an important site to talk about health system reform through the right to health. This is because it is the basic norm of democratic systems. Or as Aristotle would argue, it contains first principles. States whose constitution promotes first principles on the right to health tend to do well in their national health system. The third is policy and legislation. Policy and legislation must be translative. By this I mean that states must appropriately fund their health policy and their health legislation to achieve positive health outcomes. States that have done so also tend to do well in their national health system. And finally, the judiciary, where the courts are an important component of any effort to transform a health system through the right to health. This is because it contains mechanisms through which citizens can hold their government accountable for what goes on in the health system. States that have strengthened their judiciary to achieve this function also do well in their national health system. Ladies and gentlemen, the good news is that through a synergy of these 4 approaches, any weak health system in any part of the world can be transformed. Thank you.